We will be beginning with the All India Hepatology quiz in about 5 minutes. We just need to make some arrangements on the stage. We'll now begin with the All India Hepatology quiz, the final round. May I invite the quiz master, Dr. Arka De, Associate Quiz Masters, Rohit Mehtani, Dr. Rohit Mehtani, Dr. Akash Roy, Dr. Arun Walsan, and Dr. Ankita Singh. Dr. Arka De.
The teams, and they'll have to pick up chits to decide team 1, team 2, team 3, team 4.
Can I invite the North Zone Team A, Dr. Montan Ghosh and Dr. Abik Haldar from PGI Chandigarh, Dr. Krati Mishra and Dr. Akash Kotwal, GMC Nagpur, Dr. Siddhanta Sahu and Dr. Dhananjaya Panda, SCB MCH Cuttack, Dr. Hamsa Vardhani V and Dr. Aswin D from CMC Vellore. Do you need more chairs to see quiz masters?
The rest will sit down. Me and Dr. Arka will be on the stage. The rest will sit down.
But 8 seats.
We'll start. Where is Dr. Arka? Arka sir, he's not picking up. So we'll just ask the candidates to select chits to decide which team will be team 1, team 2, team 3 and team 4.
Hello, check. Hello, check. Check. Check.
I think we're running short of time, so without much ado, we should be starting the quiz. Am I audible? I'm audible. Please, if somebody could just go outside, and if there's anybody outside, we could just call them in also. Set? Pointer. Okay, so welcome everybody to the INASL All India Hepatology quiz. I think it's a massive effort that's been done. We have had so many, Teams have been called all across the length and breadth of the country. They have participated in zonal rounds, the East Zone, West Zone, North Zone, and South Zone. And so here we have the 4 teams who are representing the different zones of India. I just request you guys to introduce yourself. Team 1, your name, college, and the zone you're representing.
I'm Dr. Manthan Ghosh from PGIMR Chandigarh, representing North Zone.
I am Dr. Abhi Khaldar from PGMI Chandigarh, representing the North Zone.
I am Ashwin from CMC Vellore, representing South Zone.
I'm Hamsa Vardhini from CMC Vellore, representing South Zone.
I am Dr. Dhananjay Panda from SCBMCH Cuttack from East Zone.
I am Siddhant from SCB Medical College Cuttack, representing East Zone.
Hi, I am Akash Kotwal from GMC Nagpur West Zone.
Hi, I am Krati Mishra from GMC Nagpur West Zone.
Welcome everybody. So I think one point I forgot to mention is that unlike other years, previous years, these are all MD medicine students. And I'll tell you what, initially when I had set the questions of the rounds, the zonal quiz masters told me that they were too easy for them. And they're just too good and too brilliant, and hopefully this endeavor will also encourage you to bring you guys, the young people, into the field of hepatology. So here are the rules of the quiz. There'll be 3 rounds. Mobile phones should be switched off or kept silent. No prompting. Please maintain silence. And the most important point is the quiz master and my team, Dr. Akash, Dr. Rohit, and Dr. Arun. We are Trump, we are Xi Jinping, we are Narendra Modi, we are Putin, we are everybody. So we are, what we say is correct. Our decision is final, no arguing, right? So without we move on to the first round, this is going to be a clinical round, the hepatology clinics. They're going to be 25 seconds, 1 question for each team. That will not pass over, 25 seconds per question. And each question will have 2 parts. 10 points for each part. No negative marking, no passing. So team 1, North Zone. A 56-year-old cryptogenic cirrhosis patient presents to you with ascites and recurrent HE. Is a 2.2 into 3.1 centimeter hepatic SOL on ultrasound, which is confirmed as hepatocellular carcinoma on triple phase CT. There is no portal vein thrombosis, no lymphadenopathy, no extrahepatic spread. The CTP score is 11 and the performance status is 1. So what is the BCLC stage? What is the treatment of choice? The time starts now.
Sir, CTP-B, BCLC.
BCLC-B.
And we'll go for TACE.
We'll go for TACE.
Or TACE.
Right, so it's a CTP score is 11. So a CTP score of 11 means CTP class C. So it automatically becomes BCLC stage D, and the treatment of choice would be a liver transplant because it's a decommon cirrhotic patient, and the HCC is transplantable. It's within Milan criteria. So next question to team 2. Team 2, you are from which zone? So you are from South Zone, CMC Vellore. So this is a 41-year-old male patient with Hep B-related cirrhosis, presented with recurrent hepatic encephalopathy and ascites. The measured body weight is 100 kg, height is 170 centimeters, does not have any pedal edema, and there is grade 2 ascites. What is the corrected body weight and how much protein would you like to advise to this patient? Time starts now.
pass on only.
70 kg and 155 grams per day.
155 grams per day. And your rationale for why you're saying 155? So the way we adjust the body weight depends upon how much ascites is there and whether there is pedal edema or not, right? So if there's mild ascites, we correct 5%, moderate ascites 10%, severe ascites, grade 3 ascites 15%, additional 5% for if there is pedal edema. So this patient has got grade 2 ascites, there is no pedal edema, so you will correct by 10%, that becomes 90 kg. So if you give 1.5 gram per kg of protein, that would become around 135. Okay, so we move on to team 3 now. Team 3, you're representing which zone? East zone. Okay. So you have a 39-year-old male patient with suspected drug-induced liver injury. The parameters are given below. Calculate the R value and what pattern of liver injury does the R value indicate. Your time starts now. Is that very difficult?
Sir, R.
If you're not able to calculate the R value, you can tell me the formula also.
Sir, R value is 240 by 46, 6 by 2, 3.
What pattern of liver injury is there?
Sir, it's between 2 to 5, so mixed.
Brilliant. So I can admit that when I was in MD medicine or even first year of DM hepatology or something, I was never aware of what is the R value, what is the pattern of liver injury. So that's what the zonal rounds have said, that these guys are very, very good. Team 4, you're representing West Zone.
West Zone.
So we have a 29-year-old diabetic non-hypertensive male. Alcohol consumption is 280 grams per week. The BMI is 24.9. Waist circumference is 94. The patient has fatty liver on ultrasound. The AST is 34, ALT is 58, bilirubin is normal, FIB4 is 0.7, CAP is 310, LSM is 6.1. What is the diagnosis? And in one line, what management you would do?
Met ALD.
What management do you want to do?
Lifestyle modifications.
So I think I'll give it to them. It's again, very good. So Met ALD is the diagnosis, and in the management, no pharmacotherapy because the LSM is normal, lifestyle management and alcohol abstinence. Very good. So Rohit, can we have just a quick review of the points?
Team 1 and Team 2 have 0 points, and Team 3 and Team 4 both have 20 points each.
It's a long way to go, so Team 1, Team 2, don't worry at all. So the next round would be the buzzer round. And here you've got 20 points for each correct answer, but there will be minus 10 if it's a wrong answer. And if the first team who presses the buzzer, they get it wrong, it will be passed over for one time so that another team can press the buzzer. No passing after 2 attempts. There will be many association questions. Find the connection, find the association, find the link. In that, just guessing the answer will not do. You will have to give a reasonable explanation of at least some of the associations. We have to get to know your thought process. Okay, so this is an image of a hydatid cyst. What is the classification? Team 1. So if you think that your buzzer is not working, the reason is whoever presses the buzzer first, then the rest gets inactivated. So Team 1, what is the WHO classification for this hydatid cyst?
Stage 4, and this is water lily sign.
Okay, anybody else wants to press the buzzer? 1 second.
Stage 3A.
CE3A, stage CE3A, so minus 10 to Team 1, North Zone, and plus 20 to Team 4, West Zone. Very good. I think we would have a big round of applause for these guys. Okay, find the connection between the images. Team 3.
Cyanoacrylate coil. So this is for the gastric variceal cyanoacrylate glue plus coiling used for variceal bleeding, gastric variceal bleeding.
Should we give it? I think another team can have an attempt, a better attempt.
You have to connect all the 4 images.
Sir.
Anybody else wants to take an attempt? Okay, I think we'll stop it, and obviously, I don't think this needs to be passed to the audience. This is an upper GI bleed. We're taking too much of time, that doesn't work. Upper GI bleed, if everybody agrees, should we give them half of the points? I think we should still give them 5 points. So that's cyanoacrylate glue. The image on the right up, those are bands. What we do, endoscopic variceal ligation. So those are ligation bands. That's a tips being performed, and this is a Danicella stent. So these are all the various modalities that we use for tackling upper GI bleed. It could be esophageal variceal bleed, gastric variceal bleed, whatever it is. We give them 10 points here. Okay, third question, find the connection. Team 3. Excellent. Hemochromatosis, but you will have to explain. First image is Pearl's Prussian blue stage. Brilliant.
Then the MRI picture shows the liver, black liver, sparing the spleen. So it's a primary hemochromatosis, not secondary one. And then the third and fourth picture, one is micronodular cirrhosis, I guess. The joint manifestations.
So I think you've explained all the associations, and I'll tell you, when we had this image of the slide, Pearl stain was written at the top, and your zonal quizmasters told, don't write Pearl stain, they will immediately get it. So you could identify Pearl stain. Very good. Okay, so this is a video, and you need to tell me what is being trawled out of the CBD. Who was that? Team 1.
Clonorchis sinus.
Clonorchis sinensis. Anybody else? No, you can't answer anymore, please. Fasciole hepatica. Brilliant. So that's a fasciole hepatica that's being trawled out of the CBD. So I think that's team 2. Okay. Find the connection again between these slides. Team 4. Team 4. West zone.
Primary biliary cirrhosis.
Why?
First is xanthelisma. Then below that we have the Paris criteria. Then xanthelismas over lower limbs in the third image. Periductular lesions in the histopath.
I think we should still give it to them. It's enough. So he's gotten the you've gotten the xanthomas correct. The pruritus marks, those are pruritus marks in the lower leg, right? And then that's a florid duct lesion on the biopsy. Paris criteria, UKPBC, and the globe criteria. I'm sorry for not asking the audience, but we'll go back to the audience. Okay, find the connection between these images. Team 2. Team 2, please. Team 2, quickly.
It's used in the treatment of hepatic encephalopathy as the second line agent.
What's your answer first?
Ammonia, regulation of ammonia.
What's your answer again, team 2? Explain the association later. First, give your answer. Quick.
Hepatic encephalopathy because of portal hypertension.
So your answer is hepatic encephalopathy finally?
Yeah.
I think we'll stop it there. Yes. Any other team wants another attempt? Any team? So I think this one we can take up to the audience. So what could be the possible connection between these images? Anybody in the audience? Sir? So the answer is ammonia. So the photo is of Fritz Haber, the person who gave us the Haber's process for generation of ammonia. That's the urea cycle in which all the ammonia would get elevated. That's cirrhotic with a shunt. And obviously Lola is a ammonia lowering therapy. So the answer is ammonia. You had almost gotten it correct. Okay. Team 1. Why do you say it's a Minnesota tube?
Sir, there are 4 openings and 2 balloons.
These guys are a little too intelligent. That is the Minnesota tube. I really thought everybody would say SB tube. That's a Minnesota tube because there are 2 gastric ports and 2 esophageal ports. The SB tube would be having 2 gastric ports and 1 esophageal port. Okay, find the connection. Team 1.
Sir, this is Wilson's disease.
Team 1, Wilson's disease. I think somebody else. Anybody else wants to press the buzzer?
Sir.
Team 4, your chance is done. Team 4.
It is Wilson's. The first is the KF ring. Below that we have
They answered Wilson's just now. I'll give you 3 seconds. 3.
Sir, tyrosinemia 2,
Types of tyrus.
oculocutaneous Richner-Hanhart syndrome.
No.
No.
Anybody from the audience? What is the connection between these images? Yes. So sir is here, Professor Yapin. So these are all, the answer is D-penicillamine. So that's the KF ring of Wilson in which you use D-penicillamine. That is Walsh. He was the one who came up with D-penicillamine. The peripheral blood smear shows you severe granulocytosis. It shows granulocytosis. So that's one of the adverse effects of D-pen. The skin image shows elastosis perforans serpinginosa. And the last image of the gums, that's the Burton's line, which can occur in lead poisoning. And D-pen is one of the drugs that can be used as a second line agent, even in lead poisoning. Find the connection between these 4 images. Who was it? Team 1. Okay, I heard him. So absolutely correct. This is hepatopulmonary syndrome. That's a platypus. So platypus for platypnea. The pulse ox is showing hypoxia, clubbing, and the pathogenesis of hepatopulmonary syndrome being shown in the figure with intrapulmonary vasodilation and shunting. Heplisav B is a recombinant HBV vaccine that contains an additional oligonucleotide motif as an adjuvant, CpG. What does this act? Which receptor does this adjuvant act by? This is a difficult question. You want to press? Don't want to press? Thinking. I think nobody wants to answer. So from the audience again, Heplisav B. So this acts on the TLR9 receptor. So this is now again available. This is FDA approved. It's now again available in India also. So the advantage of this is that this has got a higher efficacy, possibly in patients who are immunosuppressed, and in other patients it would require 2 doses as compared to the usual 3 that we have in adults. So the adjuvant acts via TLR9. Find the connection between these images. Team 3? Team 3?
Sir, I am brave trial.
Answer first.
Then connection.
Hepatocellular carcinoma, sir.
Please explain now.
Sir, the first one is a SHARP trial, which was for sorafenib, and the BRAVE is for I am brave trial for atezolizumab and bevacizumab.
Then checkmate.
Brilliant. That's
Checkmate for nivolumab and ipilimumab. And then
doesn't matter, I think I'll give it to them. So the first is the STORM trial, the second is the SHARP trial, both of these are sorafenib. Then you have got REFLECT, light is reflecting. So the REFLECT trial is for lenvatinib, Himalaya, I am brave, and Checkmate are all immunotherapy trials. Very, very, very good. Okay, so the last question of the buzzer round, find the connection. 3?
sir, is Budd-Chiari syndrome because of polycythemia rubra vera, JAK2 mutation was there, and there was TIPS was done. Yes.
What? Last word? Okay. So this is Budd-Chiari syndrome. So you can see massive ascites, JAK2, back veins, the imaging.
TIPS is being done.
Motile liver and the TIPS. Very, very good. So can we, Rohit, can we have an update on the points?
Team 1 is at 10 points, Team 2 is at 10 points, Team 3 is at 70 points, and Team 4 is at 30 points. In this round.
Okay, so very good. So I think Team 3 is leading with 70 points, but after that it's a bit of a head-to-head between Team 4, Team 1 and Team 2. This will be the last round. There are lots of points in this, so I think everybody can still make a comeback. And the things could just completely reverse on its head. So round 3, this will be a rapid-fire round, and there will be 10 questions per team. Total time for each team will be 100 seconds, 20 points for a correct answer, minus 10 for a wrong answer. And you can come back to the question. I also need a pen. And you can come back to a question that has been passed if your time persists. Please, nobody will switch off the mics. Okay. Sometimes we're not being able to hear the questions. Okay, so team 1, North Zone, your time starts now. As per Vivino consensus, CACLD in viral hepatitis is ruled in at a liver stiffness measurement of
less than 15. Sir.
more than 15. I'll give that to you still. More than 15 kilopascal. Expand MRI PDFF.
Next question.
Mechanism of action of sofosbuvir.
NS5B.
Biochemical pattern of drug-induced liver injury that
Cholestatic.
is true or false, refractory ascites is eligible for MELD exception points during LT allocation.
False.
True or false?
False.
Very good. Who is the father of liver transplant?
Thomas Starzl.
Excellent. There's a hypodense liver space occupying lesion which shows progressive centripetal filling on triple phase CT.
Hemangioma.
How long should a patient with BCS receive anticoagulation?
Lifelong.
Brilliant. Name a PBC specific ANA.
Anti-centromere antibody.
And
wrong.
And anti E2 component of PD.
NAFLD activity score consists of steatosis, lobular inflammation, and
Hepatic fibrosis.
it's wrong. So you left behind question 2. We can come back to also time is still there. So come back to question 2. Expand MRI PDFF. Time over. Okay. So team 1.
Two negative, one they didn't answer, and seven
are
correct.
Very good, team 1. Well done. Team 2. In men, binge drinking is defined as the consumption of more than how many drinks in 2 hours? Expand VCTE.
Vibration control transient elastography.
Very good. Mechanism of action of tacrolimus.
Calcineurin inhibitor.
Brilliant. Which type of RNA is used for assessing gut microbiota? True or false? Factor VIII is produced by hepatocytes.
False.
Correct. Baltimore criteria is used for diagnosis of?
Pass.
GGT is elevated in which type of PFIC?
Pass.
Snakeskin appearance of gastric mucosa on upper GI endoscopy is seen in? Snakeskin appearance or mosaic appearance is seen in? Anti-LKM antibody is seen in which type of AIH? Type 1 or type 2?
Type 2.
Very good. Alcoholic hepatitis histologic severity score consists of neutrophilic infiltration, bilirubinostasis, fibrosis, and
Macrovascular status.
no, the answer is mitochondria. So I think you can come back to your questions. In men, binge drinking is defined as consumption of more than?
Snakeskin, GAV.
Snakeskin?
GAV.
Gave, no. Okay, so your time's up. So Rohit, what was the pointing like? 4 correct, no negatives. Okay, team 3. So team 3 is leading the quiz currently. So NIAAA diagnosis, one second. NIAAA diagnosis of alcoholic hepatitis requires heavy alcohol use with onset of jaundice within how many days of last alcohol intake?
Diagnosis. Pass.
Expand RFE.
Pass.
Mechanism of action of velpatasvir.
Sir?
Mechanism of action of velpatasvir.
NS5A inhibitor.
Huh?
NS5A inhibitor.
Very good, correct. Which group of drugs have recently been approved for the treatment of PFIC?
Sir, pass.
True or false? Either EVL or beta blockers can be used for secondary prophylaxis of variceal bleed.
False.
Correct. Stride regime is used for management of
Pass.
Banff criteria is used for
Criteria body. Pass.
treatment of choice for neonatal hemochromatosis.
Pass.
Black liver is seen in
Hemochromatosis.
no.
Dubin Johnson.
Dubin Johnson syndrome.
Okay, we'll give it to you. MELT3 consists of creatinine, bilirubin, INR, sodium, albumin, and
L3.
Female sex.
gender. Excellent. So you can come back to the questions that you have left behind. Diagnosis of alcoholic hepatitis requires last alcohol intake.
6 months.
That's wrong. Expand RP. That's it. Okay, your time is up.
RF कौन सा है? Acoustic sir, RF.
Your time is up.
So they have 4 correct, 1 incorrect.
Okay. So now we move on to team 4. Clinically significant portal hypertension is defined as HBPG of more than
12.
That's wrong. Expand PSVD.
Pass.
Mechanism of action of obeticulic acid.
Farsenoid X receptor agonist.
Very good. Name the landmark phase 3 trial of resmetirom.
Maestro Nash trial.
Very good. True or false? Voxeloprevir is safe in decompensated cirrhosis.
True.
It's false. Which cells are involved in collagen deposition in liver after injury?
Pass.
Stellate cells.
Please don't prompt. That's correct. Which anti-cancer drug should be avoided in Gilbert syndrome?
Irinotecan.
Very good. World Hepatitis Day is celebrated on the birthday of?
Hans Popper.
That's wrong. Paruch Bloomberg. Von Meyenberg complex is a biliary?
Pass.
ARC score consists of hepatic encephalopathy, creatinine, bilirubin, INR, and
Pass.
so questions that you have left behind: expand PSVD, and von Meyenberg complex is a biliary. 10 seconds left. So I think your time is up now. Okay, very good. So that was a very, very good round. I'll just give away the answers that we missed. Let's have a big round of applause for all the teams. So MRI PDFF, that is MRI proton fat fraction density. Binge drinking in men is consumption of more than 5 drinks within about 2 hours. VCT is vibration controlled transient elastography. RNA that is used for assessing gut microbiota, that's a 16S ribosomal RNA. And Baltimore criteria is used for diagnosis of veno-occlusive disease or sinusoidal obstruction syndrome. For alcoholic hepatitis, the last alcohol intake should be within 2 months or 60 days. RFE is acoustic radiation force impulse. Drugs that have recently been approved for PFIC is IBAT inhibitors, ileal bile acid transport inhibitors. Stride regime is used for the management of HCC. That is the same as the tremelimumab and durvalumab combination. And Banff criteria is used for rejection after transplant. PSVD is portosinusoidal vascular disorder, and von Meyenberg complex is a biliary hematoma. So I think while Rohit is making the final calculations, I mean, what's the opinion of the audience on these young fellows who are just doing MD medicine residence? I think they deserve a much louder applause. I think most of us can attest that even if we had appeared for this quiz, we wouldn't have scored maybe 50%. Definitely when we were in medicine or during our residency in hepatology. So you guys can tell us, what books did you read for the preparation of the quiz? Anybody? That's what I'm telling you. I'll tell you, when we initially made the list of questions, Akash, Rohit and Arun, they were very adamant. These are too easy for them. And so the questions levels were actually made tougher. And I really think you guys have performed commendably. So coming in at 4th position is Team 2 from South Zone, from CMC Vellore with 70 points. I think a big round of applause for them. Coming in at at 3rd position is Team 4 from GMC Nagpur with 100 points. Coming in at 2nd position, Team 1 from North Zone, the PGI guys, 130. And Team 4, you guys can stand up and just tell your names again. So the winners of the first All India Hepatology Quiz, Team 3 representing East Zone, SCB Cuttack with 170 points. Congratulations everybody, and there will be certificates and prizes that will be distributed. So the valedictory, please ensure that you are here to take your prize. I think it's a big honor. I mean, we as residents did not have this opportunity. It's a good endeavor that's been initiated by INASL and the Young Hepatology Forum. And I think before we stop the session, I must thank everybody from the Young Hepatology Forum, including and particularly Dr. Rohit, Akash, Arun, Dr. Saubik Mitra, Ankita, Anand, Dr. Mitra, Dr. Karan, and Dr. Sachin for helping us with all the zonal rounds and in all the preparations that was involved in the quiz. Thank you so much. Well done. Congratulations. So the general body, the HCC symposium is currently on in Hall 2, and that will be followed by the general body meeting. So I please request everybody to come and join us in Hall 2 now.
I think there's an important announcement. 8 o'clock after the general body meeting, we are having a gala musical evening here, and the performer is going to be an Indian Idol 2025 winner. Who is she? Nobody knows. It's okay. So she'll be performing here at 8 o'clock after the general body meeting. But before that, there's an HCC symposium in the hall 2. So this hall we have to vacate. This will get ready for the gala dinner. Thank you. Thank you. Picture with all the participants. Sunil, come, both of us. Yeah. And the zonal winners are there? All are there. The zonal coordinators, Ankita, others, all the the faculty or the coordinators for all the zones.
Dr. Karan, Dr. Anand Kulkarni, Dr. Mitra, Dr. Sachin,